Hi, do you feel that your child spends most of the day sucking his thumb, sucking his finger, sitting idle and doing nothing? Then, as parents, this video is for you. My name is Dr. Tanya Batra, and today, with the help of platform of Dento, I'll talk about how thumb sucking or finger sucking can be bad for your kids, not just for the oral health but their overall health. What damage can it cause, and what are the various reasons for it, and how to manage it. In my routine clinical practice, there are many parents who come and ask me that, Doctor, my child is only 5 years of age and he is sucking his or her thumb. So, is it normal? Will the habit go? Well, the answer to it is that till the age of 3 years, it is indeed absolutely normal for a child to suck his thumb or suck his finger, and it's considered okay because the only source of joy for a child is through feeding, and that gratification from feeding comes from either breastfeeding, or if the parents are busy, they are working parents, or the child is having more than one sibling, then the attention gets divided. So it's very normal for a child, in order to take that pleasure from the nutrition, to suck his or her thumb. But if this habit goes beyond 3 years of age, then it's not normal. It is the alarming sign that the parents need to step in and they need to counsel the child or take him to a dentist. Now the next question which arises in everybody's mind is that it's okay, fine, the child is sucking his or her thumb beyond 3 years of age, then what all damage can it cause? Like, the damage is only to the tooth, or it is associated with other damages also? Then let me answer this question. Firstly, the damage which thumb sucking can cause is to your thumb also, because if the child is sucking his or her thumb or finger for a long amount, and if you notice the thumb or the finger of the child, then you will see a fibrous growth over it and it becomes very hard. So the surface of the thumb is damaged. Number two, the thing which happens is that because of the pressure created by the thumb, there is forward growth of the upper jaw, which means that when the child is sucking his or her thumb, he will constantly apply pressure over the teeth as well as the jaw, so it leads to forward growth of the upper jaw as well as forward placement of the upper teeth. And along with that, because he's constantly putting pressure over the palate, which is the surface just behind your upper front teeth, what happens is it leads to narrowing of the upper jaws or upper palate, which leads to narrowing of the teeth, and it worsens the congestion. So yes, thumb sucking is not only harmful to the teeth, but it is also harmful to the jaws. So hence the growth really damages at this time. So along with that, it can lead to future problems and the child might not look good also. And that is why he might have emotional issues as well, because many children, they tend to tease those children whose teeth are not looking good, and it's very common practice in school, and the child feels very low and he feels very emotionally unstable at that time. Now we know how thumb sucking happens and what all damage can it cause, but how do we manage it? Well, let me tell you a few tips which will definitely help you out in managing thumb sucking. Number one, spend time with your child. We all know that thumb sucking, one of the reasons could be that the child is feeling lonely or is not having as much attention. So it's, as parents, it is very important for us to spend time with our child, which includes reading out storybooks to them, spending time with them, going for a walk, or maybe having food with your child. Another thing which we can do, number two, is to visit the dentist. It is very important for us as parents to take our child to a regular dental visit, because your dentist is going to be the first friend who will help your child out the most better way, because dentist knows the solution for it. He knows how to counsel the child, he knows how to help you, he knows how to give certain appliances or certain trays which will help your child to combat this habit of thumb sucking. Also, the next thing which I have heard, and the parents also tell me, and even the grandparents have told sometimes, कि अगर कोई बच्चा thumb sucking कर रहा है तो कुछ कड़वा लगा दो हाथ पे, he will definitely stop. Well, the answer to this is it is not required, because even if you do that, आजकल के बच्चे इतने स्मार्ट हैं कि वो घर पे जाकर अगर आप ऐसा कर भी रहे हैं तो वो उसको वॉश आउट कर लेंगे, किसी तरीके से ठीक कर देंगे, एंड दे विल स्टार्ट डूइंग इट, बिकॉज एनी हाउ दे नो कि इसको ठीक कैसे करना है, एंड दे गेट प्लेजर आउट ऑफ थंब सकिंग. सो दिस इज नॉट द सोल्यूशन कि कुछ कड़वा या अगर कुछ स्पाइसी लगा देंगे तो वो थंब सकिंग स्टॉप कर देंगे. दैट्स नॉट द वे आउट. द बेस्ट वे आउट इज टू गो टू अ डेंटिस्ट to seek medical or dental advice and to look for solutions from the doctor itself rather than trying things at home. I hope this video was useful. And for further updates, you can visit our website www.dento.com and even subscribe to our channel on YouTube. Thank you so much.